Hello and welcome to Gallagher's COVID-19 Insights webinar series, helping you face the future with confidence. Today is Thursday, March 19th, 2020. My name is Dean Clune, Divisional Vice President, Gallagher Better Works. Our approach to helping clients achieve organizational well-being. Thank you for joining us during these unprecedented times. At Gallagher, this has been what we've been doing for the past 90-plus years, helping our clients face their futures with confidence. It's the Gallagher way. First and foremost, our focus is on people. With the changes in our world today, it is more important than ever to think about the key issues impacting people, both at home and in many cases with our new workplace realities. So with this in mind, we will hear from key Gallagher leaders in their respective areas of expertise, starting with the latest from our compliance expert reviewing the new legislation and insights surrounding that bill. We will also discuss the human resource professional's perspective, and then close out our session reviewing the emotional well-being and impact this new world in which we find ourselves could have on our employees, your employees, their level of engagement, and so much more. And as we say at Gallagher, we run to problems, not away from them. So when thinking of COVID-19, it really does impact the whole person, because we know that COVID-19 impacts not only the potential physical well-being of employees, should they be exposed to the virus, but it impacts their emotional well-being as they worry about the unknown. It impacts their career well-being as they worry about what sick time and family leave they might need to take. And it impacts their financial well-being as employers and employees watch the news about the stock market, the potential of their employer losing business or reducing their workforce, and the impact of events being canceled due to this situation. When the individual people who make up your workforce are at risk, they're less engaged and less productive. Your organizational well-being is at risk. So with that as our framework for today's discussion, I would like to turn over the presentation to Mandy Bartoszewski, Compliance Counsel here at Gallagher, to walk us through the new bill and provide you with some additional insights. Mandy?
Thanks, Dean. So as employers prepare, well, at this stage, it's somewhere between preparing and reacting for the potential impact of the global spread of the coronavirus or COVID-19, it will be important that you consider not only how your employees are impacted, but also how they can be supported by their employee benefits during this time of uncertainty. Unfortunately, as we know, offering benefits is not always straightforward. Various federal, state, and even local compliance requirements can frustrate employers in the relatively simplest of times, much less in this unprecedented time that we're experiencing right now. So today, I'm going to raise some compliance-related issues, including related to your health plan, to employee privacy, and to leave. Keep in mind that the pandemic in general has a fluid nature, and that holds true for the compliance aspects. Additionally, we can only touch on some topics today with a deeper dive into other resources later, so please stay tuned as this situation unfolds for our alerts and resources. So let's start with the big news, and that is the Families First Coronavirus Response Act. A few quick notes about how the bill is structured because it's a little confusing. I will be speaking in a few slides down the road about the emergency leave provisions, which are what employers have likely been hearing the most about. But the first few issues we are going to go over have to do with actual health plan issues, which the Act addresses as well. The other structural or really sort of legal procedural thing I note is that the statute permits the relevant executive branch agencies to implement its various provisions without regulations. And I point this out not because it's a particularly unusual provision, it's not, and there will likely be regulations for parts of the bill, but in the case of an emergency bill, I think it's important to understand that we likely won't see any of the waiting for the administrative rulemaking process that we usually see with these huge impact laws, like the Affordable Care Act, for example. So the health plan related part of what I'll call the Families First Act for now requires that private employer plans cover diagnostic testing for COVID-19, including the cost for the associated visits to a provider, urgent care center, or emergency room for testing. Plans will have to cover the testing and associated costs with no cost sharing. We will briefly look at some state action that will cover more than testing, but for federal law, any coverage past testing, such as hospitalization or care for complications such as pneumonia, would be covered like any other illness under the terms of your plan. So, with respect to what I just mentioned, here's the latest list that we know of states whose governors have, via their insurance departments, mandated that insurers cover all COVID-19 expenses at no cost to participants. So that list on the left is the states that have mandated. So this is different from the federal law, and then it extends past testing to include coverage for associated treatment that might occur. Now, you may have realized that there's actually no effective treatment for mild COVID-19 disease. So hopefully in many cases this won't come up. But these states have taken steps to require comprehensive coverage by insurance for those who may unfortunately need extensive treatment. Remember, this means insured plans only, both a large and small insured market. The list on the right there are states whose governors who have encouraged, or in words of several of those bulletins that they've issued, expected insurers to cover COVID-19 costs. And we're hearing that many, perhaps even all, the major carriers are complying or cooperating. So for insured plans, the current upshot is that it's likely that your state insurance department or your carrier will dictate the terms of coverage related to COVID-19 and that it will be comprehensive. For self-insured plans, the options may be more variable, so make sure you're communicating with your TPA. I have not yet heard whether carriers that act as TPAs, sort of the big carriers that act as TPAs in the ASO environment, have made any blanket decisions about coverage under their platform, so make sure to stay tuned for that in your own situation. So in light of all that on the state and the federal level, being a compliance person, I know one of the first things that I thought of is how these state laws and carrier decisions and federal law would affect individuals who contribute to an HSA. In what seemed like unprecedented, but in any case unexpected speed, the IRS released Notice 2020-15 to answer that question. In short, this notice indicates that such coverage will not cause individuals to lose their eligibility to contribute to an HSA. This is pretty straightforward. Just keep in mind that this notice did not modify previous guidance regarding requirements for a plan to be an HDHP other than with respect to this relief for testing and treatment of COVID-19. Now, keep in mind, unless you're one of the states I mentioned, and particularly for self-insured plans, you should consult your carrier TPA, determine exactly what benefits the plan will provide for COVID-19, including the cost sharing. The IRS notice itself is not a mandate. It's an exception under the tax code that would allow an HDHP plan design that would otherwise be incompatible with HSA. In other words, we have no reason to believe that waiving cost sharing for treatment for COVID-19 would be automatic, except perhaps where state law requires automatic amendments or automatic adjudication of claims, but instead would require a plan to amend its terms. So while the IRS notice doesn't specifically address this issue, unless your plan document provides that all items and services, for example, permitted by the IRS are covered expenses, amending your plan terms would be recommended here. So here are a couple of other considerations that wouldn't necessarily be required, but that employers may want to consider. Again, first I would talk to your carrier TPA, or in some cases vendor, to understand whether they would be willing and how they're willing to handle various issues that may be affected by, for example, huge numbers of employees working remotely or being furloughed or actually being sick or on other leave. First, your DCAP plan terms likely already allow the standard election changes, but this pandemic could cause employees to want to change their elections in various ways, so make sure to check the rules under your plan and amend them if you choose. For example, on one hand, some families won't need child care anymore because the parent will be at home due to COVID-19, at home and not be able to work. On the other hand, some folks that work in essential roles, such as healthcare workers, first responders, even grocery store workers or gas station workers, may need care for school-age kids because school is closed. A few more ways you might want to amend your policies to ease some of the friction that this pandemic has caused might include relaxing your wellness program incentive requirements for a period of time. So, for example, it's not recommended that I go get my biometric screening right now, both because of the risk of exposure, but also because labs are either really busy right now or actually closed for anything other than emergency issues. You might consider suspending the too soon to refill limitations on prescriptions so that folks can stock up for what might be weeks or months when it's not actually recommended to go out of the house. Or even just for quarantined employees, you could suspend that limitation. There will definitely be other aspects of this that come up under your plans. But for now, next to finally, employers will undoubtedly want to consider using telemedicine if you aren't already. That's something that's been coming up a lot. And finally, remember that ERISA fiduciary rules still apply. It's not a great idea to make a bunch of ad hoc decisions affecting folks' benefits, especially in sort of this kind of turmoil. And it would really help to understand what your plan offers currently, what it requires currently, and then make decisions and amend accordingly. So to shift gears a little, let's do a quick review of HIPAA privacy and security, that is. When we think about infectious disease in the workplace, a lot of folks, compliance attorneys included, a lot of our minds go to privacy concerns. I think employers and plans are very used to thinking about HIPAA in this context, but I want to make sure that HIPAA-permitted disclosures aren't really the main issue here for plans. Outside of healthcare providers, so maybe you are a healthcare provider or a covered entity in a way other than through your health plan, but as your role as a business or employer, HIPAA privacy requirements still apply to group health plans, and I honestly can't think of an exception permitted under HIPAA that would permit a plan to disclose protected health information related to COVID-19. So, for example, if there has to be some kind of some kind of disclosure in order to protect other employees, it really never should come from the health plan, and in any case shouldn't likely include identifying information. Now, that said, remember that private health information in the hands of you as an employer is not covered PHI under HIPAA. We've gotten a lot of questions about whether an employer can let folks know about an employee with COVID-19, that is, let other employees know, but that typically won't be a matter for HIPAA. It would likely be covered under the confidentiality provisions of the Americans with Disabilities Act, or in some cases under FMLA, for example, in a return to work situation. For privacy concerns, you should work with your privacy officer or preferably your legal counsel if you're contemplating any non-standard disclosures related to the health status of any employee or employee's family member. Okay, as I promised, we're going to go back to that Families First Act. We're first going to turn to the paid sick leave part. We're going to turn to the parts that are most likely important to you as employers, and those are sections E and C, or divisions C and E as I call them, the Emergency Paid Sick Leave Act, what we're calling Emergency Paid Sick Leave, and the Emergency Family and Medical Leave Expansion Act, which we're calling Public Health Emergency Leave. And we distinguish these because they are overlapping in some cases, sometimes not, and they're separate and have several separate rules. So first, the emergency paid sick leave. This section of the new law requires employers with fewer than 500 employees and government employers to provide employees with 2 weeks of paid sick leave. Specifically, employees who are unable to work or telework will be entitled to 2 weeks of paid sick leave paid at the employee's regular rate due to one of the following reasons. 1, the employee is subject to a federal, state, or local quarantine or isolation order related to COVID-19. 2, the employee has been advised by a healthcare provider to self-quarantine due to concerns related to COVID-19. 3, the employee is experiencing symptoms of COVID-19 and is seeking a medical diagnosis. 4, the employee is caring for an individual who is subject to a quarantine or isolation order as described in that first scenario, or who has been advised to self-quarantine as in that second scenario. 5, and this is a big one, the employee is caring for a son or daughter whose school or child care has been closed, or the child care provider is unavailable due to COVID-19 precautions. And finally, sort of a catch-all, which would be one of those scenarios where we might see regulations, the employee is experiencing any other substantially similar condition specified by the Secretary of Health and Human Services in consultation with the Secretaries of Treasury and the Department. Okay, what else falls under this new paid sick leave? Under the Act, an employer's obligation are limited to paid leave of $511 per day, which translate into $5,110 in the aggregate, where leave is taken for an employee's own illness or quarantine. It's limited to $200 per day, or $2,000 in the aggregate, where leave is taken to care for others or for school closures. Full-time employees are entitled to 2 weeks, which means 80 hours for full-time employees of leave, and part-time employees are entitled to the typical number of hours they work in a 2-week period. And we don't have any clarification on that, but hopefully there'll be more guidance, because you know that we've been doing this thing with part-time employees, 30 hours, 40 hours under the Affordable Care Act. So there's no clarification on that, so stay tuned. There will also be an employer notice requirement for which DOL should be issuing a model. Okay, finally, a few more provisions on the emergency paid sick leave. An employer can exclude employees that are healthcare providers or emergency responders. An employer cannot require an employee to find a replacement as a condition for taking leave. Now, one thing, some employers may already have sick leave policies, and this requirement under the emergency paid sick leave, unlike the public health emergency leave we'll talk about in a few minutes, applies in addition to existing employer policies. This could have the effect of employees being entitled to more sick leave than you would have expected or intended, but employees would only be able to take the statutory leave for COVID-19 purposes. Finally, this is currently a temporary law, which expires on December 31st of this year, and no days that the employee would be entitled to under this section would carry over until next year. Okay, let's shift to the other section, and that is the public health emergency leave, which is essentially an expansion of FMLA. The Act temporarily amends the Family and Medical Leave Act, FMLA, to provide employees of employers with fewer than 500 employees and government employers, that sounds familiar, who have been, but this is new, who have been on the job for at least 30 days with the right to take up to 12 weeks of job-protected leave for public health emergency leave. So again, the first thing to notice is that this section has a 30-day service requirement that the paid leave section does not. To qualify for public health emergency leave, an employee must be unable to work or telework due to a need to care for their son or daughter under 18 years of age because the child's school or place of care has been closed, or the child care provider of the son or daughter is unavailable due to a public health emergency. Under this provision, the public health emergency is defined to mean an emergency with respect to COVID-19 declared by a federal, state, or local authority. And that's important because it can't just be self-declared by the person who decided that they think it's a bad idea to go to work. So how does this part of the leave work? Well, it's paid leave, but the paid aspect is a little tricky because it only kicks in after the first 10 days. But that doesn't mean that an employee will be uncompensated for those 10 days. The first 10 days of leave may be in the form of the emergency paid sick leave that I just described, if it qualifies as one of those paid sick leave reasons that we talked about. Or an employee may choose to substitute accrued vacation leave, personal leave, or other medical leave during this period, but an employer can't require an employee to do so. And finally, an employee may also take unpaid leave for the first 10 days. After 10 days of leave, employers must continue an employee's public health emergency leave at a rate of no less than 2/3 of the employee's usual rate of pay. The Act limits the amount of required paid leave to no more than $200 per day and $10,000 in total. And I wanted to point out that 2/3, make sure you're paying attention to that, because in a previous version of the House bill, that 2/3 of the pay rate showed up on the sick leave provisions, but that is no longer. The 2/3 only occurs in the second phase, that public health emergency leave. Again, an employee must provide advance notice as soon as practicable of a need for leave under this temporary provision, but that's only when the leave is foreseeable. So this part of the law does have some extra exclusions similar to the 30-day service requirement that I mentioned. One is that an employer can exclude health providers or emergency responders. We did see that. Also, though, as with traditional FMLA leave, this leave is job protected, which means that an employer must return the employee to the same or equivalent position upon his or her return to work. However, under this emergency public health leave, there is an exception to the job protection provisions for employers with fewer than 25 employees if the employee's position does not exist after FMLA due to an economic downturn or other operating conditions that affect employment caused by the COVID-19 pandemic. And I assume we will see that fairly often. The Emergency Family and Medical Leave Act takes effect 15 days after President Trump signs the act, which was yesterday, on March 18th, and will remain in effect for 1 year from the date of the President's signature. So remember I mentioned that this law can take effect without implementing guidance, and I think I've already pointed out one situation that we will probably see some regulations. So one other thing that the Secretary of Labor has the authority to do is issue regulations to exempt businesses with fewer than 50 employees where the imposition of the requirements would jeopardize the viability of the business. However, when and how businesses with fewer than 50s will be exempt is currently unclear. So I wouldn't take this as employers under 50 don't have to do it. So just be mindful of that. That could be a future exemption, and we hope to see additional guidance on this point. And finally, a few quick points. Provisions that are pretty straightforward and apply to both the sick leave and public health emergency leave. We've seen a couple that seem to apply almost identically, but these really do apply identically. One, you can't fire, discipline, or discriminate against any employee for taking leave. That is in the paid sick leave law, and emergency sick leave law, and is in the underlying FMLA statute and regulations. And also the paid leave benefit on both cases can be excluded from an employee's gross income. So, speaking of taxes, to assist employers who need to fund each of these kinds of emergency leave, the Act provides a refundable tax credit equal to 100% of qualified paid leave wages paid by an employer for each calendar quarter. Now, for tax purposes, just like we've seen several times, that the type of leave matters. The Act distinguishes among reasons an employee is paid qualified paid leave wages, sick or family or emergency public health wages. For employees who are subject to a quarantine or seeking diagnosis or treatment with respect to COVID-19, the amount of qualified sick leave wages taken into account for each employee is capped at that $500 $511 per day. Similarly, for amounts paid to employees for other qualifying reasons for paid sick leave, that taking care of the child whose school has been closed, the amount of qualified leave wages taken into account is capped at $200 a day. The aggregate number of days taken into account per employee may not exceed the excess of 10 over the aggregate number of days taken into account for all preceding calendar quarters. This tax credit in both cases is allowed against the tax imposed by the Internal Revenue Code Section 3111A. That's the employer portion of the Social Security taxes. If the credit exceeds the employer's total tax liability under that section for all employees for any calendar quarter, the excess credit is refundable to the employer. This is pretty straightforward to prevent a double benefit, or a double dip as we call it. No tax deduction is allowed for the amount of the credit. In addition, no credit is allowed with respect to wages for which a credit is allowed under Code Section 45S, which is the Tax Cuts and Jobs Act credit for providing paid FMLA if any employer has taken advantage of that credit. Finally, with respect to effective dates, there was no exact date for the tax credit provisions in the statute, other than it can be no later than 15 days after the President's signature, which again was late last night, March 18th. Okay, let's shift gears a little bit and talk about, given the constraints that the Families First Act may have on certain employers, but certainly keeping in mind that it will affect others facing various scenarios for leave, let's talk about some considerations for benefits for employees on leave. There are too many iterations to dive deeply into any one scenario today, so please keep in mind that what you are able to do as an employer with respect to benefits, and in some cases what you must do, depends on factors such as where you are located and how many employees you have, but also in exactly what type of leave or workforce change you're looking at. So will you have a handful of employees on FMLA or disability? Are you looking at some selective layoffs or furloughs? Are you looking at major reductions in hours but no layoffs? Are you looking at flat-out terminations? We could talk for a long time about some of these details, but I think a few things you want to keep in mind are the ACA employer mandate, how to collect premiums, and how to continue coverage. And the first step for any of those considerations is to check your plan document, check your SPD, check your plans and policies, and check with your carrier or TPA to try to understand what you're currently obligated to do in any given scenario. So listen, I am a realist. Not every scenario will be covered in your plan document, even if you have the Rolls Royce of plan documents and SPDs. So if you need to, take stock what's happening right now and amend your plan document in a prospective and non-discriminatory manner to address specifically the various scenarios you need to address. So just to give a couple of examples, so your plan terms might tell you what you need to do in the case of a RIF or a temporary layoff. For ACA employer mandate purposes, remember you may, for example, have a part-time or variable hour or seasonal employee population, some of them being in a stability period. So they might be entitled to continue coverage, even if hours are reduced below the eligibility level because they earned the coverage during their measurement period. Similarly, if you are hopefully able to rehire some folks after a layoff, they've only been gone, under 13 weeks is the magic point there. Are they ongoing employees for purposes of the ACA? Again, check the terms of your plan to understand your next steps and make decisions as to whether any amendments need to be made in light of the circumstances. One question we have gotten a lot is whether furloughed employees can or should be continued on active or COBRA coverage, and at what rate. Again, your plan terms may address this, but it may also just become a business decision. If you decide to try to continue active coverage before offering COBRA, be very sure to check with your carrier or your stop-loss carrier and amend your plan, even if you might amend it back in the future to account for future circumstances. And finally, Employers who are in the unfortunate position of having to close their doors or conduct a mass layoff, in addition to COBRA responsibilities, and this is a little outside of the Bennett's world, but worth mentioning, I think, the WARN Act requires employers to provide written notice of at least 60 calendar days in advance of covered plant closings and mass layoffs. Okay, so that was a lot. So with that, I would like to recap in action step format some of what we discussed today. First, do your best to comply with all applicable state and federal law, whether COVID-19 related or other laws, including some upcoming applicable reporting deadlines under the employer mandate. Check your current benefit plans and sick leave policies, your other leave policies, and don't forget collective bargaining agreements or any employment contracts you have with employees. Consult your insurer or TPA for COVID-19 specific and unrelated coverage, but also what options you have. You might consider benefit changes, for example, shifting cost sharing or using more telemedicine. You might want to encourage use of your EAP if you have one. If you are in the position of offering COBRA because of a layoff, a reduction hour, or furlough, considering COBRA subsidies to take a little of the sting out of it. But in any case, make plan or policy amendments, and if you have to make any amendments, and notify your employees as soon as possible of any changes. And I would just like to point out to consult an attorney if you want to do anything, if you're considering doing anything out of the ordinary, such as disclosing PHI in a non-routine manner, or considering mass layoffs or furloughs or plan terminations.
Well, Mandy, wow, that was a lot. Thank you so much for kind of summarizing that, and I think there's a lot of good news in there, and actually one of the things that's fun is we have a new acronym to add to our list of acronyms, so we're going to have some fun with that as well.
Thank you.
You bet. So let's let that soak in a bit, and at the same time, let's pivot slightly. Kevin Mikas, one of our HR and compensation consulting experts, we thought it would be good to talk about and have Kevin talk to us a little bit about not only the policy implications that you'll want to know about and consider, but also the impact this unprecedented time might be having on your employees and issues impacting your company culture. So, Kevin, talk to us.
Thanks, Dean. I'm going to cover today some key areas of focus from a human resources perspective. We all find ourselves in unprecedented times, which requires out-of-the-box thinking. So my two areas of emphasis today are going to be new policy frameworks, as well as our focus as HR leaders on engagement and culture, and that focus is key now more than ever. So I want to talk with you about the framework for support. That being said, I would suggest this approach of creating a specific pandemic policy and guideline framework is going to help you kind of package all of these buckets that you see in front of you here in a targeted way, again, to address these unprecedented times, and it will help you, help prevent you from feeling like you are creating a precedent by stepping outside of your current leave time policies, for example. So most organizations that we are working with are leveraging really a task force approach, so HR and other key internal leaders and constituents making decisions, policy decisions in these areas. Obviously under time off, based on what Mandy walked you through, you are going to want to create, articulate, define, put into writing the Families First Act elements if those are applicable to you. If they are not, Then I'm going to walk you through some things that we are seeing other employers do in response to their time off policies as they stand today. Most importantly, the message of the day is flexibility. As we focus on employees, they are our highest priority in this framework, and so looking at how we are addressing that, we're going to need to be flexible and agile in how we approach that. Alternative schedules, many organizations are having to respond differently in terms of their business continuity plans. Many are transitioning to either some or all employees in a remote work capacity. Certainly how you are handling travel, business and personal, we'll get to that. And then outlining your policy around or amending your policy around visitors, and then some best practices around hygiene, all of which you can put within the framework of a pandemic-specific policy. So these are all elements that really reinforce when we think about employee well-being. And when we think about employee well-being, this can fall under the element of career well-being, so how we are taking care of our employees in this regard. And I would say, interestingly, that when under career well-being, we are taking care of employees in this area, they are 2 times more likely to be healthy in the other areas of well-being. So whether that be emotional well-being, financial well-being, etc. So keep that in mind, and that the importance that this really creates, and really lean into your most critical leadership competencies right now: agile thinking, compassion, change management mindset, and then certainly communication. And in these times, over-communication is critical. So we need to communicate early and often, as I like to say. So for employers who may need to address the specific policy elements around the Families First Act, we understand what those are now from Mandy. We have a lot to absorb there. For employers who fall outside of that, looking at how to respond in these circumstances. So we are seeing varying employer responses, whether that be offering emergency leave, paying up to 10 or 14 days should someone feel concerned about coming to work, whether they have underlying health conditions or care for a family member with underlying health conditions, you know, whether it be a parent, a grandparent, etc., allowing employees to borrow PTO in advance of accrual, PTO donation banks, and then certainly recognizing that FMLA and other state-mandated leaves of absence, or the public health emergency leave, are all potentially going to be at play here. So recognizing, you know, kind of the overlap there. We're also seeing employers softening their points and attendance policies during this time to, again, create those supportive structures for employees. And so when we think about time away from work, it correlates directly with not only the emotional and physical well-being, but also the financial well-being of employees. So it's about compensation. It's about still being able to feel confident and being able to pay our bills, et cetera. And so when 50% of American households have no savings, we have to really kind of step back and determine in our own organizations the financial and morale impact of you know, trying to subsidize as much as we can to take care of employees because of that impact. Other things that we're seeing employers do in terms of compensation, I saw yesterday that Mark Zuckerberg provided Facebook employees with a $1,000 bonus. He's also indicating that all employees will get their highest performance rating, so it will allow them to get the rest of the bonuses that they would be eligible for the remainder of the year. Hospitals are obviously critical to the state that we are in today to be supportive. Those employees are now more than ever putting themselves at risk. So we're seeing hospitals respond with, providing hazard pay to doctors, nurses, et cetera. So these are just a few examples of, when I reference flexibility, please think outside of the box here. So when we have sick employees, let's talk about some key elements here that are nuanced because of COVID-19. So as it relates to the EEOC guidelines on taking temperature, I would submit to you that while the EEOC indicates that this is typically considered a medical exam and should only be provided by a medical professional, they are indicating this being spread so easily from public interaction that they have recently shifted or softened that. I still would say please make considerations depending upon your industry and or your access to the public, or you are a manufacturer and your goods are being handled by the utmost OSHA requirements, etc. We are seeing some in different industries doing temperature checks. Outside of that, we would just encourage employees to do daily health checks in terms of taking their temperature, monitoring, the degree of cough that they had, and, quite honestly, really just lean in on policies we should have already had in place, which would be, if you are sick, don't come to work. And really just focus on the recovery of the employee. And you can, if someone shows symptoms or expresses to you that they are having symptoms, you can send them home. I will say if you have a positive in the work environment, or if you feel you have a potential exposure in your work environment, privacy and non-disclosure are key here. You should communicate to the workforce that there could be or that there is a positive in the work environment. However, under privacy considerations or regulations under the Americans with Disabilities Act, individual employee names should not be disclosed. When we think about doctor's notes for return to work, we're seeing really employers soften on that because the reality is our healthcare system is already strained, so the reality of being able to get a doctor's note is less. So I would also submit to you as leaders, if we are telling people to either stay home or we transition to a remote work environment, I would submit to you that reinforce with your leaders that martyr awards are not being given. So don't think that, oh, I need to go into the office and show my leadership. This is actually a time when showing leadership is really being there kind of in the same boat as your employees. So if you are encouraging remote work, you work remote as well. Otherwise, if you step outside of that, it can create potentially pressure that employees might feel to come into the office, and that's the last thing that we want to do right now. So those are just some helpful hints. So alternative work arrangements are certainly being explored as a means of business continuity responses. We're seeing people visit and consider and implement staggered scheduling. So in light of social distancing, creating a smaller staff staggered schedules of those who might be in the office, so you can reduce that person-to-person exposure. Also, either reduction or modification in business hours are also being considered, as well as, again, as I mentioned, remote workspaces. So want to remind folks that time tracking, particularly for non-exempt employees, is still very important based on, particularly if you have those individuals working remotely. So want to reinforce again, don't forget the importance of two-way communication. So yes, communicate early and often, but also encourage managers and leaders to do more frequent check-ins with staff. And if you are an organization who has not fully embraced, or maybe you've partially embraced remote workspaces, this is going to require different, flexing our muscles differently as leaders. So helping equip our managers with best practices around managing a remote workforce is helpful. And when we think about the other critical areas of focus, that being engagement, and I think we can continue to focus and keep our finger on the pulse there. So levity is not a bad thing. Engagement, things that we're seeing other employers do, include, trivia, weekly trivia contests with winners receiving a gift certificate for delivery of food from a local restaurant, which helps our local communities, particularly when the restaurants are suffering right now. Fun challenges as it relates to quarantine playlists, asking your team what songs would be on yours. So don't forget to have fun as best you can, and create that levity in the workplace that will help you heighten engagement during this very stressful time for people. Travel, when we are working with employers and across industries, certainly seeing bans and limitations on business travel to conferences or other meetings and events. Many conferences are being, as you have seen or experienced, are being canceled, delayed. And then, banning celebratory non-essential travel for employees. Would suggest not prohibiting employees' personal travel. Oftentimes there are state laws that prohibit the mandate of employee personal time, and also you can address it more on the back end in terms of return from a vacation. We're seeing many employers institute kind of quarantine periods before that individual comes back into the workplace. Hygiene guidelines, these are pretty self-explanatory and are supported by and provided by the World Health Organization. So all of these things, hopefully, we are doing. I will say, to really be mindful about not panicking. And, we are still dealing with the common cold and flu season. So we're seeing some employers, unfortunately some managers, really overreacting when someone sneezes. And it could create an environment where people are actually being bullied and create almost a hostile work environment. Unfortunately, we've dealt with a couple of those situations here lately with clients where people are, calling others out in front of their employees or coworkers. So really want to, particularly as HR leaders, help our managers stay focused on, that supportive framework and, really addressing those issues if you see somebody responding to a coworker in that way. So just a reminder, with many of the things that I've discussed, just ensuring that whatever our policies are that we have in place, just ensuring that those are imposed or adhered to in a non-discriminatory manner. And I would just say, lastly, most importantly, you want to lean in with compassion, clarity, and your culture.
Patty, thank you so much, and thanks to all the HR professionals out there, who are so key to their employees and companies during this time. So as you said, Kevy, how we handle this and how we lean into these challenging times will make all the difference in the world to both your people and the company's culture going forward. So let's keep going in this direction, and potentially from an organizational level, higher level, Kathleen Schultz, Gallagher's innovation leader and thought leader. Kathleen, you spend your time kind of looking for what's coming, helping prepare our clients face their futures with confidence. Kind of with our new reality, what should we be thinking about and planning for?
Yeah, thanks, Dean. So I think one of the things that we really need to be focused in right now is it's important to understand that even prior to COVID-19, we were already dealing with near epidemic levels of stress, anxiety, loneliness, and depression. So almost 20% of us, again, this is pre-pandemic, 20% of us would likely experience some type of mental or behavioral health issue this year. The cost to us personally and to businesses are staggering as we think about the impact on productivity, on absenteeism, presenteeism, and healthcare costs, which could be 2 to 3 times higher for any of us experiencing a mental behavioral issue. And even as we think about employee engagement, that can be negatively affected if the employee perceives that the work environment is part of what's causing them stress. So as we think about our landscape today, we know that managing through sickness and ill health at work can be challenging really at any time, but it's especially so during this infectious disease outbreak that we've got right now with COVID-19. Employees are anxious. They're fearful about contracting the virus at work. They're scared about bringing it home to their families, potentially losing pay for time off, and not being able to pay their bills or support their families. So at this time during the COVID-19 outbreak, the fear associated with the unknown, which is compounding the already high levels of stress and anxiety and depression that we're seeing in society, may be an equal or even more significant threat than the physical manifestation of the virus itself. So you've seen from the presentations from Mandy and from Kevy that the acute organizational need so far has really been around compliance and HR policy. However, as the pandemic continues to evolve and it continues to unfold over time, we really need to make sure that the employee perspective and promoting emotional well-being are at the forefront of the employee response. So as COVID-19 really continues to spread, social distancing obviously is firmly in place right now. Community closures are increasingly common. Organizations are making hard decisions right now on whether to impose forced work from home measures. While these measures can be effective at controlling and slowing down the spread of the virus, the way that we work is going to change. Symptom-free employees on quarantine or forced work from home may first welcome the opportunity as kind of a mini vacation. That can change pretty quickly when the reality of quarantine or isolation at home kicks in. The reality of your children being home from school and potentially disrupting you while you're trying to work, the reality of having your significant other needing the same home office space that you need, which was my reality today, as this morning my husband and I flipped a coin. I won and got the office, he lost and got the basement. And this last reality, which I think is really, really important, and that is the reality that the support system that you've developed at work, kind of the extended family of colleagues and friends that you interact with live every day, that support system that helps fuel your energy and your productivity, that may be lost or look very different. This social connectedness and interpersonal support is a really powerful predictor of human resiliency, which is really about our ability to be able to bounce back from adversity. It's to be able to withstand and recover and grow in the face of stressors and changing demands. So if ever there was a time for us to be promoting resiliency and emotional well-being, it's now. So what else do we know about resiliency? We know that the stress we're experiencing right now is impacting every generation in our workplace and negatively affecting resiliency. We know that lower levels of resiliency can increase the potential for burnout and loneliness and increase the likelihood of us getting sick, which is absolutely the last thing that we need or want. We know that when individuals experience burnout, their engagement and excitement about the job will decrease over time. So on the upside, we know that we all have resiliency. We just may have it in different amounts. So some of us, purely by genetics, are more resilient than others, but all of us can enhance our resiliency. And as we think about our COVID-19 response planning, building social and interpersonal support needs to be a critical component of your plan. It will not only help promote employee well-being, but positively affect employee commitment to your organization over time. So how do we do that? The first thing to think about is really optimizing the resources you may already have, namely your EAP. Promoting your EAP, communicating the resources available to employees to help with stress and anxiety, leveraging the management consultations that are available through many EAP providers for assistance on handling different employee scenarios. There are so many services available through EAPs that employees just might not be aware of. We can use this opportunity to bring visibility to all of the services available and hopefully start to chip away at the stigma that is sometimes associated with the EAP. Encouraging physical activity, fitness apps, online group classes, getting outside when you can be critical to reducing stress and promoting positive physical and emotional well-being. We also have to be careful that we don't sit for too long. Our routines are changing, so sitting for long periods of time is not good. We need to get up. We need to make sure we fill our water bottles. Our routines are changing, and that's hard, but it also gives us an opportunity to create new healthy habits with your family and potentially virtually with work colleagues, which brings us to the important part of really focusing on creating connectedness. We should really be thinking about providing intentional opportunities for employees to connect with each other, to help support each other, and to stay connected as a team. So do not automatically cancel meetings that would normally be in person. Instead, let's shift them to the phone or shift them online so we can stay connected and on top of the employee perspective and on the employee pulse, and also keep moving forward on business objectives. When we can, be flexible and generous where possible. Not every employee request is going to be able to be honored, but relaxing some normal practices and policies may do a lot to ease nerves. If the request can't be honored, it's important to be able to explain why. And then last, it's really about understanding what we might see as a shift in terms of employee engagement drivers. With our recent labor market being so competitive, we've really seen engagement drivers related to purpose, organizational mission, and values become increasingly important to attracting, engaging, and retaining talent. However, in the face of these economic and financial uncertain times, we may see a shift towards engagement drivers surrounding organizational stability and leadership confidence. What we know is that we're in uncharted waters. It's important to really give employees several different options to be able to voice their concerns, their fears, whether that's to their manager, to HR, maybe it's to a safety committee, or through an anonymous channel for those that might not be comfortable speaking up. We follow up individually where we can and where that's possible, and company-wide and periodic updates when that's appropriate. Providing an empathetic response, as Kevin mentioned, will help employees feel heard and promote social support. It's also important to really be aware of the emotions that can optimize performance, health, and happiness in every interaction. Appropriately demonstrating these emotions when interacting with employees, or really anyone for that matter, it's good for you. It's good for your health, and it's good for enhancing our sense of connection to others, which we know is so important to building resiliency. Delivering on these emotions in an authentic and sincere way can sometimes mean that we have to be a little bit vulnerable, but with that helps build trust. That level of trust is so important right now as we look to reduce stress and promote emotional well-being. Employees want to know and trust that their leaders are going to get them through this crisis. Let's talk about leadership and communications. How how employers respond to the COVID-19 virus will have a lasting impression on their employees and influence, positively or negatively, their commitment to the company. The messaging and the behavior of all leaders within the organization, which includes the C-suite, but it's not just limited to the C-suite. It's really all managers, all leaders. This is going to set the tone for how cared for employees feel during this difficult period and will demonstrate the organization's commitment to both employee and organizational well-being. Communication needs to be authentic, transparent, and timely. It also needs to be in the regular voice of the organization, whether that's formal or informal or maybe even humorous. And that there's obviously nothing funny about the pandemic, but if the normal voice or style of communications within an organization is lighthearted, the same style should really flow through on your pandemic-oriented communications. Communication needs to be accurate but not perfect. A message to employees letting them know that your plan is not complete, but it's being worked on, is better than no message, which has the potential to really fuel rumors and inaccurate speculation. So Dean, before I get ready to toss back to you, one more thing. It's not enough at this time to just say the right things. We really have to do the right things. Leaders need to follow the guidance that they are distributing and understand that through their words and their actions, they've got a significant opportunity to positively influence the employee response and reduce employee stress. If the guidance is to work remotely, but leaders still come to the office, we've missed the opportunity to model positive behaviors, potentially eroded trust, and added confusion and stress as employees may wonder if they are really expected to show up even though the guidance says stay home. It's also important for leaders to just be real and compassionate. Leaders who share their own challenges. Maybe they're experiencing challenges with technology. Maybe they're having their own challenges related to childcare or getting their kids home from college. Or maybe like me, they're really worried about their aging parents. Being able to share those challenges and be real can go a long way towards kind of putting a human face on this pandemic and letting employees know that we are all in this together. So I probably not the best word choice, and I hate to use the word contagious in the face of a flu pandemic, but honestly, I think it's the right word. The leader responses, whether they're positive or negative during this crisis, will be contagious to the employees within their workplace. Employees may not remember every word shared during the pandemic, but they will remember how they feel about their organization's response. Back to you, Dean.
Kathleen, thank you so much. And as you said a bit earlier, we are sensitive to the fact that how long you've been sitting listening to this webinar, and we appreciate you. Appreciate all the speakers and listeners as we kind of run into the home stretch here. Hopefully you found this information to be meaningful. We know that how we respond and understand the impact of COVID-19 will continue to be a hot topic. And so I know that Kevin touched on the survey that we opened to help gauge how employers are addressing key concerns with COVID-19. So let's focus real quickly on the survey just for a minute. We sent this survey out over 2 weeks ago, and over 700 companies responded. And so think about how our world has changed in that time. But let's see, where were the employers at that time? You can see that 83% of employers did not have a comprehensive emergency plan in place. 50% do not offer full wage continuation for employees for involuntary absences. And 37% are not prepared to offer additional wages to healthy workers, assuming extra responsibilities. And kind of rounding that out, 72% have had to modify policies to allow for working remotely where possible. So as I said, this survey was our COVID-19 preparedness survey. We are past those times, obviously. So please be on the lookout and participate in our next survey to help us understand the current landscape, where we are, and we will be continually updating you on that. So we want you to know that we have a lot of solutions at Gallagher and support, and we encourage you to reach out with your questions and your concerns. We're really here to help you face the future with confidence in all the different areas of your business. And we have a lot of solutions. And as we know that there is a need for timely and insightful information. Our experts will share additional insights. I mentioned that this is a webinar series, so we're going to have a variety of key topics in the coming days and weeks. Today's session was the first in that series of webinars that will be made available. And as you can see, we're kind of planning quick hit sessions on topics like leadership in crisis, business continuity plans, financial well-being, vendor solutions, and really many additional timely topics. So stay tuned. Go to ajg.com/pandemic preparedness for updates and information and insights that will be provided there, and continually keeping our clients up to date on this fluid situation and fluid concerns. So we want to thank you for your time, and we want you to remember that at Gallagher, we are here to help you, help your employees be better with all the individual complexities that they bring to work with them each day. Thanks for taking your time to be with us, and we wish you all the best.